Please introduce yourself and what you do.
So my name is Dr.Köhne. I'm a physician. I'm a medical oncologist. So I work at the University Clinic in Oldenburg, and I'm the director of the oncology and hematology department in Oldenburg.
What is oncology and hematology?
Okay, oncology and hematology is usually treating patients with cancer. To differentiate between oncology and hematology, I would say oncology is treating patients with solid tumors. So tumors coming from organs like the lung, the stomach, the gut, or any tissue, while hematology is treating leukemias. And you may separate hematology into benign hematology or cancer hematology. Yeah? But most of the time we do treat leukemia patients.
When did you realize that you wanted to work in the field of medicine?
Yeah, that was a bit when I was at your age. Yeah, I wasn't sure, as probably everybody. My father was a pharmacist, so he wanted me to be a pharmacist, but I didn't really thought that was of much of interest. So I was a person who was a bit idealistic probably at that time. I was thinking of something to help people. So what could help people? It could be working at the grocery store because everybody needs some food. You could become a priest because a lot of people, it helps them. Yeah? And my decision was then to be a doctor.
How were your school grades?
I was the best at my school. That was the school is called Neue Oberschule in Braunschweig. That was gymnasium. Yeah. The grades were good enough to become a medical student.
What were your interests in high school?
Well, my subjects at school were physics and mathematics, actually. And I never liked biology, but biology is so important for medicine. Maybe this encourages others that, if you not even into those subjects that you would really need at university or for becoming a doctor, you can still become a doctor, because sometimes it takes some time that you catch up with other subjects. Yeah. So that was my interest. Actually, I hated German, but when I was starting to publish, I realized how important it is to be really precise in what you want to say. Other interest was I was leading the photography club at our school. I was a swimmer. I was swimming at that time.
Did you continue to pursue these interests in university?
Yeah, not swimming at all, but mathematics. I think it was really of importance because when I started to do clinical research, yeah, you have to work very closely with a statistician. So if you do clinical research, you have, for example, a new drug, and you want to compare it with something which is used before, which is the standard of treatment of care. And you have to develop a hypothesis that the new drug is better than the standard of drug. And you have to say, well, I anticipate it's, let's say, 20% better. And in order to find that it is 20% better, you need to have certain amount of, or no certain number of patients in the standard and in the experimental arm. So here you have to have a kind of understanding of what's going on, and thereafter you have to analyze this, and you do this with a statistician, but you have to talk to him and have to have a growing understanding of, what is the result and how you can interpret the results. Yeah. And I was also programming at that time small programs, databases, which probably came out of math and physics.
What kind of research did you conduct?
Yeah, I did clinical research, so I was not a laboratory guy. He was mixing different things or looking at cell cultures. I designed clinical trials together with pharmaceutical companies. We thought of the hypothesis that we would meet, looked at on different on the number of patients, and then we started the trial, which is demanding because you have to write a protocol. The protocol has to pass a certain committees, and once you have the data together, you have to analyze them, and then you can publish the data. And I did this at the University of Hanover, and then I did it on a European level at the EORTC, European Organization for Research and Treatment of Cancer, and this was with other doctors from other countries, from European countries, and they agreed on this protocol, and they put patients we had patients not only from Germany but also from other countries.
How long did you study for?
Well, I was 7 years because I was 6 years. It was 6 years, and I had another year where I did my doctoral thesis.
Can you start working as a doctor right after you finish your studies?
Yeah, at that time you could start right away, but nowadays you have to go to further education. So you can either be a general doctor, a GP, you would call it, or you could be a specialized doctor. So you have to do some training in hospitals and different wards or in outpatient clinics, and thereafter you are a doctor of general medicine, or you are trained as a cardiologist, or as in my case, an oncologist and hematologist. And this takes another at least 6 years. So you have to pass an exam, and then you are called, you're a licensed doctor with a specialization of oncology and hematology.
Why and when did you decide to specialize in oncology?
Yeah, that was actually at the very beginning. Actually, well, my first thought to become a pediatrician, but I couldn't get a job there. And then the second choice was to become a medical oncologist. And I found it interesting because a lot of research was going on there. Actually, when I started, we only had a handful of medical drugs that we could use. But in the meantime, the field has expanded dramatically. So I realized that there's a lot of advances going on there, so I found it very interesting to start there.
Would you recommend the same career path to students today?
That's a difficult question. Yes, generally yes, because I feel that being a doctor is very rewarding. The social recognition is very high, yeah, and you can feel that, yeah. And medicine is open for a lot of things. Your career could be just to be a doctor, but you can also go to research. So you have all the opportunities, which takes long. It takes long until you earn real money. Yeah, but it's very, very rewarding. The conditions you do medicine now, that's the drawback, because medicine now is very much economically driven. So you have somebody who tells you, well, this is not good because we are losing money when you do this. It's not as frank as that. It's sometimes you feel that, yeah. So the pressure is very high on medicine. The staff is being reduced. So what we see is that the output of hospitals has grown since the 90s to this years. The staff has been the same. Yeah. But in general, I would be happy that everybody of you would become a doctor, because we need doctors in Germany. We have a shortage of doctors, and the job is great.
Is it difficult to cope with the often sad fates of patients in your field?
Yeah, it is indeed. especially if you treat patients for a long time and you get a personal relationship to those, then it's sometimes difficult. But on the other hand, you can look back at the time that you gave them. Yeah. When I started medicine, some diseases, they only had a life expectancy of, let's say, 6 months. Yeah. But now you follow those patients up for 8 to 10 years. Yeah. So that's very rewarding. Yeah. And you see that the treatment you give the patient is really helping them. On the whole, you can cure 50% of your patients. So, yeah, this is something which is really rewarding.
What do you do as a doctor?
I'm an internist, so usually I get patients where the cancer is already known. So they have breast cancer, they have gastric cancer, they have lymphoma, and then I try to find out what is the major complaint of that patient. Does the clinic, we say, the clinical presentation of the patient, does it fit to what the pathology report says? And then I have to decide, what is the approach of the patient? Is it a curative approach, although they are not curable by surgery at that time? But if we shrink the tumor, then we can ask the surgeon to operate on that. On the other hand, you have the palliative approach as compared to the curative approach. So the palliative approach is to avoid too toxic treatment, but to have the patient to keep the quality of life of the patient, but at the same time control the tumor and to extend life as much as possible. So the concept of our treatment is very important to decide at the beginning.
What is your favorite part of your job?
The favorite part is actually I enjoy talking to patients. I enjoy the conversation with patients. I enjoy also, but this is unfortunately not so frequently at the time, I enjoy doing research, giving lectures, traveling to other countries, and have the conversation, the discussion on new trials, the interpretation of new trials. What does it mean for the clinic? These were the things that I enjoy very much. Yeah.
What is your least favorite part of your job?
It's difficult to tell, actually. Maybe I'm in the position to organize some work to other people that I don't realize that it is not so much liked by me. Sometimes I have to be at committees at the hospital. You get only a certain number of staff members because the economical people have calculated that you're in minus again, you're producing red numbers. Yeah, this is what I dislike.
How many hours do you work a week?
60 at least. It depends how you define work. Yeah. Very often I work on the weekends as well. That means traveling around, giving lectures somewhere. That's also part of the work. Yeah. But I would say the good part of it is that I don't realize it as this being work so much. Yeah. Because it's work I like, because it's rewarding. So you don't realize it as a burden so much. Yeah. So that means, 60 to 80 weeks, 80 hours per week.
What advice would you give to students that plan to work in your field?
I would encourage a lot of people to become medical doctors. You have to do what you feel is your field. So there are other fields that are important as well. As a medical doctor, you can be just a doctor, you can be a teacher as well, you can be a researcher, so this is very broad. I mean, you have to learn a lot. You have to be keen to do that, but you will have a subject in front of you, which is developing dynamically, dramatically. I would say it's probably the strongest growing part of medicine, actually.
Thank you for your time.